Hi everyone, my name is Valentina Zapata and my topic is therapeutic hypothermia in diseased organ donors and kidney-graft function. First, definition. Therapeutic hypothermia, also third charge temperature management, is an established intervention that is used to protect neurologic function in patients with certain types of cardiac arrest, stroke, and asphyxia. Applications in medicine. The effect of therapeutic hypothermia on renal protection is uncertain. However, in a retrospective study involving patients with cardiac arrest, mild hypothermia appeared to protect against renal injury. An experimental study involving rabbits shows that rapid cooling into moderate hypothermia preserved renal function during cardiac arrest.
After kidney transplantation, delayed graft function, defined by the need for dialysis within 7 days after transplantation, affects up to 50% of renal allografts obtained from deceased donors. While therapeutic hypothermia is an established intervention used to protect neurologic function in patients with certain types of cardiac arrest, the benefits of hypothermia for renal protection have remained uncertain. To investigate the role of therapeutic hypothermia in this setting, the authors randomly assigned organ donors after neurologic determination of death to one of two targeted temperatures, 34 to 35 degrees Celsius, the hypothermia arm, or 36.5 to 37.5 degrees Celsius, the normothermia arm. Temperature protocols were initiated soon after donation was authorized and ended when organ donors left the intensive care unit for organ recovery in the operating room. During the trial, 572 patients received a kidney transplant. Delayed graft function developed in 39% of those in the normothermia group as compared with 28% of those in the hypothermia group. The study was terminated early after a pre-planned interim analysis showed that hypothermia was associated with a significant benefit. This trial demonstrates that inducing mild hypothermia in deceased donors before organ recovery lowers the rate of delayed graft function in recipients.
Pros and cons. Pros. Preserve renal function during cardiac arrest, reduction of free radical production, and reduce the odds of delayed graft function. Cons. The effect of target hypothermia to protect renal function during the donation process is uncertain. In trials, there were 4 adverse events in organ donors. 1 episode of dysrhythmia, 1 episode of systemic hypertension, and 2 episodes of cardiac arrest before organ recovery.
Therapeutic hypothermia is a treatment for a variety of things. In the case that I'm interested in for brain injury, I became interested in therapeutic hypothermia approximately 2 decades ago when I was working with a fellow named Guy Clifton at the Medical College of Virginia, and Guy was demonstrating that in animal models, cooling the animal to about 89 degrees Fahrenheit or 32 degrees centigrade could make a big difference in the outcome of that animal after the animal had had an experimental head injury. So that I thought was an important breakthrough, because we knew that cooling to lower temperatures could cause some real problems with the heart. In particular, it can cause the heart to stop beating. Additionally, cooling to low temperatures can cause problems with coagulation of the blood, so that there will be hemorrhage problems. So I thought that was an important breakthrough and something that could be accomplished in the clinic in the hospital setting. So I began using hypothermia at that point when I returned to the clinical practice, and We did a number of studies, myself and a number of other investigators did studies with hypothermia primarily for patients with severe traumatic brain injury. And by that I mean patients who were comatose following the initial impact and were brought to our emergency department unable to follow commands or to interact with their environment. We think that cooling helps to improve outcomes following brain injury from a variety of causes. So you can have brain injury as a result of cardiac arrest, for example, where there's a loss of blood flow to the brain for a period of time. You can have brain injury from a stroke, but more relevant to my clinical interests, you can have brain injury from an impact to the head or trauma or traumatic brain injury. That injury, whether it's from stroke or cardiac arrest or trauma, will cause a period of ischemia or lack of oxygen supply to the brain, followed by inflammation, release of a number of toxic chemicals into the brain, and disruption of the metabolism or the mechanics of the brain. All of those things we think can be improved with cooling.
Issue apply in Ecuador. In Ecuador, it is not a very common practice because it requires the infrastructure, technology, and the precise knowledge for the production. Conclusion. The revision of these prospective trials showed that target temperature control in donors had a clinically significant protective effect on renal graft outcomes in recipients. Thank you.